Hello everyone, I am Dr. Donald Ozello of Championship Chiropractic in Las Vegas, Nevada. I am the author of Running, Maximize Performance, and Minimize Injuries. Thank you for visiting Dr. Ozello's Sports Medicine Report. Please feel free to leave any feedback, suggestions, or questions in the comments section. Also, please feel free to like this video. You can visit my website at championshipchiropractic.com where you can get more information on the book, and you could also get links to my other social media sites so we can connect there. Please enjoy this sports medicine video. On today's episode of Dr. Ozello's Sports Medicine Report, I'm going to be doing something a little bit different. I will be discussing and demonstrating an exercise that I have named roll-ups. Roll-ups are a combination of three motions. Roll-ups are going to help to strengthen the spine, specifically the upper part of the mid-back, the posterior part of the neck, and the muscles that attach the spine to the shoulder blades that pull the shoulder blades backwards. These muscles are called the scapular retractors. Strengthening these muscles is very important to improve posture and to improve upper body motion. Many times I see people who are sitting in poor posture. They may be working at the computer and they're doing this, or they're on the cell phone and they're in this position, or it may be a senior who's walking, who's using his walker and is in poor posture. What we want to do is strengthen the muscles that do the opposite of poor posture. Strengthen the muscles that pull us backwards, open up the rib cage, allow the spine to be in its correct position. Doing roll-ups is going to accomplish that. Strengthen the spine and strengthen the scapular retractors will help to improve posture and improve upper body function. Roll-ups are best performed in the seated position. Now I'm going to turn to the side so you can see me do it. When we are doing roll-ups, I'm going to sit nice and straight on a sturdy chair. Roll the mid-back and the neck forward. Put the chin towards the chest. Roll forward as far as you can. Let the shoulders come forward. Now this is the starting position. From here, take a deep breath in and breathe out. While you're exhaling, slowly straighten the thoracic spine, one vertebrae at a time. The thoracic spine is a medical term for the mid-back. While you are straightening the thoracic spine, retract the scapulas. That's the shoulder blades, meaning pull the inside borders of the shoulder blades towards the spine. Then the final motion is cervical retraction. These are the three motions that I spoke about. Now I'm going to do it again. Come down into the starting position. Slowly straighten the mid-back, one vertebrae at a time, so you could feel those individual vertebral movements and vertebral segments moving. As you are straightening the thoracic spine, retract the shoulder blades, and then retract the cervical spine. Retracting the cervical spine consists of moving it backwards. You want to hold this position for 2 to 6 seconds and then relax and move back to the starting position. Start with 2 seconds and then you build to 6 seconds. Roll-ups are isometric exercise. Like I mentioned, you start with 2 seconds and then you build up to 6 seconds. You want to work nice and slow. You never want to hold your breath while you're performing any type of exercise, but especially this exercise, because there's motion in the rib cage. You want the rib cage to be able to move the way that it should. Performing roll-ups is going to help to strengthen the mid-back, the posterior aspect of the neck, and the shoulder blade muscles. This is going to help with the breathing. It's going to open up the chest. I'm going to demonstrate again. Bring the chin to the chest. Roll the mid-back forward and let the shoulders roll forward. Now slowly inhale and exhale. As you're exhaling, straighten the mid-back. One vertebral segment at a time. Feel each of those vertebrae moving. As you're doing that, pull the shoulder blades backwards. Do the scapular retraction and then the cervical retraction. Hold this position for 2 to 6 seconds and then relax. If any part of this exercise elicits pain or symptoms, then you want to modify the exercise. You always want to work through a pain-free range of motion. For example, if moving the neck backwards into retraction, when you're all the way back, if that starts to cause symptoms, say maybe tingling or numbness down into the hands, then you want to modify it so you're just moving slightly. Always work through a pain-free range of motion. These exercises are to benefit you, to build strength, to improve posture, and increase function. Never work into an exercise that causes pain. Never move into a motion during an exercise that causes pain or symptoms. Roll-ups are a fantastic exercise. They're going to help you a great deal. Perform 15 repetitions a day. Start at a lower number. Say start at whatever number works best for you. If it's 3, if it's 6, if it's 8, whatever number you're at, work up to 15 repetitions. Begin with a 2-second hold and then work up to a 6-second hold. Roll-ups are a fantastic exercise, going to help you a great deal, improve your function and improve your posture, which is going to help you in everyday life. It's going to help you perform your activities of daily living. It's going to help you in sports. It's going to improve your posture. Perform your roll-ups 3 to 4 times a week. Every other day works best. So you do the exercises one day, the next day you rest, the third day perform the exercises again, just like that, every other day. It works perfectly because you train the muscles, then you allow them to rest and recover, then you train them again the next day. Roll-ups are a fantastic exercise for helping to build strength and improve posture. Do them on a consistent basis. Think of this as an exercise that's going to help you long term. Obviously it has short-term benefits, but think more in the long term and you will really see the benefits of doing this exercise correctly. This has been Dr. Donald Ozello of Championship Chiropractic in Las Vegas, Nevada. Thank you for viewing this episode of Dr. Ozello's Sports Medicine Report. Train hard, train smart, stay injury-free, and accomplish your goals.